Hey, Dr. Drew here again. I'm today speaking to Dr. Donna Wong. She's a family practitioner, has been practicing general family practice for over 20 years. Dr. Wong, welcome. Thank you.
Thank you.
Why do people think of going to the emergency room when it's not an emergency?
I think the first thing is understanding what a true emergency is.
Okay.
So if you go by the true definition of what the insurance companies consider an emergency, it's what they consider is threat to life or limb. So if you're not thinking you're going to die, or you don't think your limb is going to fall off, then it's something that we can take care of on an outpatient or out of hospital setting. And that's where HEAL can come in.
Let's talk about the kinds of things that commonly really should be seen in an emergency room. So chest pain?
Chest pain, absolutely.
ER. Shortness of breath?
Shortness of breath.
Active bleeding?
Active bleeding, vomiting, blood.
Altered sensorium?
Yes.
That's about it.
Seizure.
Seizure, sometimes, not always. But a primary care guy could take care, or gal could take care of that over the phone sometimes.
Right.
But yes, a first seizure for sure. First seizure. Falls, head injuries, I suppose.
Correct.
Limb injuries that where you can't bear weight.
If something's hanging off, if something's protruding that should be on the inside and not the outside.
Or something that's gone outside in.
Right.
Not so good.
Correct.
But that's, I mean, really it's for life-threatening situations.
Correct.
And the ER doctors are deciding, is this person going to die?
Right.
How do I make that not happen? Do they need hospitalization?
Mm-hmm.
And then let's get them out of here.
Right.
That's what the ER doctors are thinking
That's
about.
right.
What are we thinking about as primary care practitioners?
As primary care physicians, we're not so much thinking, are you going to die in the next 30 minutes? We're thinking about what's causing your pain, not just making it stop. We want to find the source of your problem and get rid of it permanently.
And then get your health maintenance up to par.
Correct.
Deal with what other issues are there in your family or your emotional landscape, or help you with your insurance resources even. I mean, we do all that, right?
Well, we try to prevent you from being ill. I mean, ultimately, that's the doctor's mission, is to prevent illness. We don't like seeing sick people. I mean, if we could have a world of healthy people, that'd be fantastic. So we try to maintain your health, help you do so, get you to where you need to be. We're a resource. You know, by definition, doctor means teacher.
Yeah.
And so we're supposed to teach. But that's not what most people see us as being.
Not only that, the ER is supposed, the ER doctor is really, I mean, they're well trained to do their job.
Absolutely.
But they're there for they've got to take care of everything in one visit.
Right.
We accept the responsibility for you ongoing.
Mm-hmm.
You can call us 6-8 months later, and it's our responsibility to bring you in, follow you up, get you referrals. We've accepted that responsibility. Right. I don't think people get that.
Right. I mean, as primary care physicians, we take care of you for a lifetime. You have diabetes, you have high blood pressure, you have any chronic disease, we're there. We make sure as you go through life stages that we control it in the life stage you're in. Because does diabetes change between when you're 30 and 80? Absolutely. Does hypothyroidism change between the time you're 30 and 60? Absolutely. Does the history of you having diabetes when you were 20 and pregnant affect you when you're 60? Yes. So these are the things we think about. We think about the entire picture.
And heading trouble off before
Correct.
we get to trouble.
Absolutely.
Yeah. And as a HEAL physician, I could ask for you as my primary care doctor.
Absolutely.
Yeah. And you would set up follow-up even if we wanted to do that.
Absolutely.
How convenient.
No, it is very, very nice. I mean, as a HEAL physician, I've seen travelers who don't end up in the emergency room.
Meaning people from outside the area?
Outside the country.
Wow.
Okay, because their traveler's insurance will refer us, and we go and we see them, so they don't end up in the emergency room. I saw a little kid from Brazil with a rash all over his face. His mom took out all his medicines that she brought from Brazil. I looked over it. I saw what, got a history as to what could be exacerbating his rash today, and then supplemented his medications so he can enjoy the next 2 weeks in the States.
Yeah.
Versus spending 2 hours in the emergency room.
But right, and being exposed and paying for all the infrastructure and personnel that are there that you don't need.
The medical, I consider physicians, consultants, specialists, all of us as a team.
Yeah.
We help each other.
Yeah.
We supplement each other. We, as family physicians, know our patients beyond their health sometimes. We know their circumstances. And the specialists are tied for their time too. And so sometimes they'll miss things that are small little caveats that make a difference. And so we take their information, and that's where we all need to communicate.
Yeah.
And going to the emergency room, sometimes you can't get that information.
Yeah.
So, yeah, absolutely. Communication is really, key in what we do.
And if anybody has a question about should I go to the emergency room, you can call your primary care person, and we'll tell you, call the paramedics, or don't, or go, or we'll see you tomorrow. But that is clinical judgment.
Correct.
And we as patients, even clinicians as patients, don't have clinical judgment.
Right.
That's why we as doctors have to check in with doctors.
Exactly.
You can't be objective about your subjective condition.
Precisely.
Yeah, I've tried that. It doesn't work.
I mean, I can't tell you the number of times somebody will call me in the middle of the night when I was, in private practice, and they're like, what should I do? And we talk about it. You calm them down, and you know how they are. You know what their norm is, and you say, okay, I think we could wait 2 hours, come to the office and see me.
Right. And you wouldn't say that unless you really felt confident.
Right, exactly.
Right. Well, Dr. Wong, I appreciate it very much. I think I really think this is an important topic, and I hope people take heed. So,
I do as well. Thanks so much for your time.
You bet. Pleasure.